And the next up, we're going to have Daniel, and he's going to talk about medical technology. And I think it's a great flow because we're taking a lot of the theory and the science, and we're building solutions that really help humanity. And so Daniel's going to give us a walk into how that works.
Yeah, thank you, Cheryl. And thank you, Tammy, as well, for putting together this session. Yes, cool. My slides are up. So I work on developing new health sensing technologies and features. I'm an engineer. I build systems, and these systems are focused on understanding how the body works and understanding it in a way that helps us to make things better. And so what is health sensing? What is a health sensor? A health sensor is something which measures something related to health. It's a super broad term. And I think it's interesting. I love working on it. I find it fascinating. I find the work itself very engaging. Like, it's a good match for my background and the things that I can build. Question here, which is, why does this matter? Why does it matter that we work on health sensing? It's a very big field right now. It gets a lot of attention from companies like Apple and Fitbit and Google. But why does it matter? Like kind of when we really drill down to it, why should we work on this? And I think it matters because we live in a world where our health is not as we hope it would be. I think we would all agree with that, probably regardless of our faith or our worldview. We hope that our health is better. Like, we would hope that we don't get sick in the way that we do. And as a believer, I also believe that we were made to live in a world that is better, a world in which there isn't this sort of brokenness or sickness or illness. And so I think that's, for me, part of why I find this work interesting and why I find it meaningful. It's because we live in a world where we hope for something more than it is right now. And I want to talk about a couple specific motivating examples. And we've already touched a lot on infectious disease. And I think we've talked a lot about COVID. I think it's important to remember how significant flu is as well. And that infectious disease is a very pervasive problem, whether we're in the midst of a pandemic or not. This is the plot of the flu deaths in the United States for the past 6 years, excluding this past flu season. And it varies quite a bit year to year, but roughly 30 million people get the flu each year in the United States, and roughly 40,000 people die from it. And so these are non-trivial numbers. This is a big impact on a lot of people. And I think we would all agree that we would hope we could make these numbers smaller. And so this is an example of a place where we hope for something more. And another place that I'll mention, and I think I bring this up in part because this is an area in which health sensors and wearable health sensors have had a lot of focus, is on our heart, and how it's pretty incredible. Usually, for most of us, it beats perfectly for 80 years, but not always. Sometimes it beats a little bit wrong. And one condition called atrial fibrillation is one that's gotten some attention, one where health sensors have been trying to address this. And really what this is just when our heart doesn't beat quite right. It doesn't have quite the right rhythm anymore. And it's pretty common. On the order of 12 million people have AFib in the United States. And on the order of 25,000 will die because of it each year due to some complications such as stroke. And so these are two examples of places where our nature is imperfect, where we hope for something more, and whereas I as a believer believe there is something broken and something that was made to be different and made to be more healthy and more whole. And so this is a lot of the motivation for why I think health sensing is interesting. And these are two areas in which health sensing, especially wearable health sensing, is engaging right now. And I want to kind of dive in a little bit on disease spread, infectious disease specifically. And kind of one major point here is that we have the agencies to intervene, and we have done incredible. With COVID-19, we've all become very familiar with how we can reduce the spread of infectious disease. And there's simple steps we can take, such as washing our hands a lot, wearing masks, keeping distance from people, like being aware if we're sick and not going out and not interacting with people. And they have an impact. We heard a lot about flattening the curve last year to keep from overwhelming our healthcare system. And steps like these that each of us can take do have an impact. So we've been able to build up these tools to make the imperfection, to make the brokenness in the world a little bit less powerful. We have the agency to intervene. But interventions often don't work perfectly. Tomas already showed a slide like this, and I think we're all very familiar with these sorts of figures. This is just new cases across the world of COVID-19 since the start of the pandemic. And we can see there's peaks and there's troughs, but this has been pretty high kind of throughout. And even with everything we can do with masking and distancing and now with vaccines, this is still a big problem. This is still deeply impacting a lot of people. And so we have agents, we've made great progress, but there's more we can do. We haven't gone all the way. There's still something that's imperfect, something where we hope for more. And so I think health sensors provide a new line of attack on this. And it is a very new line of attack. And it's a kind of a small extension. The efforts that we have to address these problems are old and mature and big and powerful. And we don't know how helpful this will be yet. But it's kind of a new way we can approach this. And so I'll talk about one specifically, which is hand washing on Apple Watch. Apple Watch has this feature where it helps you wash your hands. Apple launched this last year. And at first, it seems interesting. It seems very intuitive. It's also not obvious how helpful it is. And how it works is it uses the motion sensors in Apple Watch. Apple Watch has sensors called accelerometers and gyroscopes, and it uses these to figure out how much your wrist is moving. This is part of how it knows how many steps you're taking, how much exercise you get. It uses those sensors. It also has a microphone. This is another sensor. It's a sensor which picks up sound. And Watch takes these sensors, it takes the data it gets from them, it runs those through algorithms. And these algorithms help it decide, is this person washing their hands or not? And when it decides, yes, I think they are, it starts a timer and it gives the person feedback to help them wash their hands better. It helps encourage and assist people in kind of changing their behavior in a way that's helpful. And so sensors might help make this a little more personal and a little more precise. You'd never have a doctor who wash your hands every day. You don't want anyone to do that. But if you have this watch that lives on your wrist that you wear anyways, maybe it can help you do that. Maybe it can be this very personal and precise little assistant on your wrist, helping you make decisions and helping you change your behaviors in a way that's better for you and better for those around you. And so this does raise this question, does this actually help? How much impact does this feature have, or might this feature have? And it's really hard to know. This is very new. It's very hard to quantify. But we can make some assumptions. We can look at some data, and we can try to get a sense for kind of what order of magnitude would this have. And we know that hand washing is very effective at slowing the spread of infectious disease. This has been very well studied for things like flu and cold. And we know that good hand hygiene can reduce cases of flu by 20 to 50%. And so there's opportunity there to make an impact. So if we make a big assumption here, and we just say that Apple Watch, this feature, makes you about 1% better at washing your hands. I don't know exactly how we quantify that. We'd have to think a lot about how to measure it. But let's say 1%. I think that's reasonable, just based on my experience using it. If you kind of work through the numbers, you build this model, given that there's tens of millions of Apple Watches out in the world, you can actually see that at scale and across the population, we're probably eliminating thousands of flu cases each year. And an individual user won't notice this. No one's going to say, Apple Watch kept me from getting the flu. But at scale, this small impact can help reduce the caseload. That's the idea. We don't know yet. Like, we haven't really studied this. Like, we haven't been able to look at how does this impact us? And honestly, I'm not even sure how we would over time. But I think it's worth trying. I think this is a new line of opportunity. This is a place where healthcare hasn't quite been able to reach before. And there's new ideas. And I think this is just one example. Atrial fibrillation is another example where wrist-based wearables, other wearables, can help us make healthcare a little more personal, a little more precise, and open up new opportunities. So we don't know the impact, but let's try. Let's work on some of these things. And I see a hopefulness in this. I see a hopefulness in this type. There's this quote in Romans, this passage in Romans that I love and often think of kind of when I'm working, which is that the creation waits in eager expectation for the children of God to be revealed. For the creation was subjected to frustration, not by its own choice, but by the will of the one who subjected it, in hope that the creation itself will be liberated from its bondage to decay and brought into the freedom and glory of the children of God. There's this idea here that creation is longing for this. There's this eager expectation. Creation right now is subject to the bondage of decay, and it's yearning to be liberated from it. And I think for me, when I think of the bondage to decay, I think of things like illness. I think of things like the spread of infectious disease. There's something there that's not quite as we would hope. It's not quite as God would hope. And we have agency, like through the children of God, like there's this hope that can change. And so there's this hopefulness in this work. And I think it's shared by kind of healthcare broadly, by many other disciplines. Health sensing is this very small niche within it, but I think it shares this character. And so there's this hopefulness in it. But it's just a hopefulness. Like, it's not a hope in itself. Like, health sensors are never going to eliminate cancer. They're never going to reverse a car accident. There's a limit to this. They point in the direction of a world which is a little less broken, of a world that feels a little bit more whole. They point in that direction, but they're not an ultimate hope. They're a reflection of a deeper hope. And this is another passage from Romans, which I also love, because I think it helps me remember that the work itself won't fix everything. We glory in our sufferings because we know that suffering produces perseverance character, and character hope. And hope does not put us to shame because God's love has been poured into our hearts through the Holy Spirit, who has been given to us. While we were still sinners, Christ died for us. There's this hopefulness to my work in health sensing that I feel. I think it's common to a lot of work in healthcare and a lot of fields, but it's a measured hopefulness. Like, it's this hopefulness that comes from a discipline that kind of points in the direction of a world that's a little more whole. But it's measured because it's not ultimate. Like, we have to like remember that Christ is the ultimate thing on which this can do as a believer. And so that is kind of how I have been thinking about my work. Health sensing helps us it gives us some opportunity to push back a little bit against the imperfection of the world. It might give us a new line of approach to help us move a little bit towards more of how we would hope it to be. And I think ultimately for me, that kind of reflects and reminds me of the hope that we have through Jesus. So thank you for your time and attention.
Yeah, I love it. I love like how we're so inventive and creative, and that we can take our knowledge solutions into products that that help alleviate some of these imperfections in nature. So we're going to open up time for questions and comments. And Tammy, I see you have a question. Maybe you'd like to ask it.
Yeah, I can ask the question. So I was wondering, one of the things that I think looking at Apple products brings up for me is like, you know, it automatically kind of, for me, I usually think about who can afford that. And so like a natural question, you know, in the past, I've thought about Apple products from like a digital divide standpoint, the people who have access to iPhones, you know, belong to a certain category of the world economically. Like I'm interested in hearing how you see maybe the same type of potential phenomenon in health fencing and how that might be able to be addressed.
It's a fantastic question. And I think it's a hard question as well, because I think there is a challenge here in that these features, these health features tend to enter products that are expensive, and that's where they start. And I think for me, I see some reason for optimism in this, in that things like PPG, which is the method that's behind heart rate sensing. You can now buy wearables on Amazon that have this functionality for $10. And so I think the ability to make these measurements by oneself without having to go to the doctor, without having to enter the traditional healthcare system, being able to know, hey, my resting heart rate is actually going down because I'm exercising more. And being able to do that with a relatively inexpensive device. I think there is some reason for optimism there, but I honestly do think this is a very valid concern, that this is providing new tools to people who have the means to access them. And I think that's an area we should be thoughtful about.
Any other questions? I know like you probably.
I was just going to ask Daniel, do you have in mind, or are you aware of other type of sensors? I mean, not to give any IP away, but just I'm interested. The examples you gave are great.
Yeah, no, there's a lot of interesting work. Of course, a lot of stuff related to the heart is of a lot of interest, right? So measuring heart rate, measuring blood oxygen are things that we can do. There's some health sensors now that look at things like arterial stiffness, so how hard your arteries are, which is important, especially as you get older. And there's a lot of really interesting work in this space. It's a very hard space, though. Our bodies are actually really good at like looking good. Like trying to measure something through the skin is just really hard to do.
I have a question real quick for Daniel. So I'm interested in kind of your thoughts on data privacy, but it's a big topic, right? But more so like specifically, so we had like these contact tracing apps for COVID where phones could check proximity against each other. I wonder where you think that's going in the future, because some of it requires like having community level information. And you mentioned kind of using the scaling of like the millions of devices worldwide, billions, I guess. I guess what are some hopeful directions for how that could kind of be leveraged for helping global health?
Yeah, that's a great question. I think there is a little bit of a tension between privacy and the ability to impact public health. With contact tracing apps from Apple and Google, they very heavily prioritized privacy, almost to the detriment of the ability to actually act on the information. And so I think there is just some degree of fundamental trade-off that has to be made there, and maybe empowering users to make that decision, like good messaging around that. Like if like you opt into this actually helps, even if you're trading a little bit of privacy. So I think that's an area where just good conversations are really important, just in being able to resolve that question.